Welcome to the second TV show about the mental health transition process in Lancaster County. I'm Gwen Thorpe, and today I'm joined by Dean Settle, Jane Raybould, and Ron Sorensen. We'd like to talk a little bit about what we have done thus far in the process and where we think we will be moving to next. Let's start with Jane. Jane is a commissioner and is going to sit on the committee, the Invitation to Negotiate Committee. Jane, can you bring us up to date?
Certainly. Well, we are working on getting out further communication, and this is one opportunity to get the word out. We have a letter that's going out to many interested groups to keep them updated. We have signed the contract with Region 5 on the Invitation to Negotiate, and the responsibilities are carefully laid out in that document, and so we look forward to moving forward on this project. It's an exciting project, and there are many wonderful people that are on the committee, and they have all agreed to serve very carefully with a lot of deliberation and thought. So it's a great committee. We hope to have a lot of dialogue on the subject, and it should be a great process.
I look forward to hearing how that goes as we move forward in these shows. What about the Crisis Center? That was an issue that we didn't have a solution to last time we did a show.
Well, the commissioners reviewed the Crisis Center, and we feel it's a very integral part of our operations, and we have made a decision to keep the Crisis Center open, and we have also made a commitment to look at other opportunities down the road with the Crisis Center. But most importantly, we have made a commitment to maintain the level of services at the Community Mental Health Center. So we want to assure everyone, and certainly the consumers out there, the families of consumers, that everything is going to stay just as it is right now at that very same location. And we are going to be working through these issues very carefully with a lot of dialogue and contribution from certainly Region 5, the committee members, and we will continuously keep everyone updated on the progress that we have going forward in this transition period.
Okay. We will also, I think, continue to want to let the community know how important you commissioners feel these services are in the community, and that your commitment is to making sure that they are provided both now and into the future in a very great fashion.
And I think that is worth repeating, that all the commissioners have made that commitment, and the consumers and the families of the consumers should feel very comfortable that that is a priority with us. The Community Mental Health Center does a tremendous good in our community and makes our community stronger because of all the outreach that they do. We just want to assure everyone that that is our firm commitment, that we will continue to provide that same level of care and commitment and service to those out in our community.
Thank you for articulating that. I think that's very important. And for our viewers, before the show is over, we will show you a website, an email address, and a physical address that you can use to get in touch with any of the commissioners.
But it doesn't hurt to mention it right now. So
Okay.
if you have any concerns, you can always go on lancaster.ne.gov. But if you need to communicate with the county board and the county commissioners, you can go to commish, COMMISH, at lancaster.ne.gov. And we would love to have your input and feedback, and we certainly will respond, and we welcome your concerns.
We do, thank you. And as they showed that web page, there is a mental health transition link on the left-hand side of the home page that will take you to the page that is showing now, but it will have information up there, new information. We'll make sure to keep that updated. So
Great.
Thanks, Jane.
You are
Appreciate
welcome.
that. Dean, I want to visit with you a little bit. Dean is officially retiring. I should state that today is May 22nd. Dean's officially retiring the 25th.
Friday at 5.
Friday at 5. Dean has served the county so well in not only the capacity as director of the Community Mental Health Center, but prior to that, the director of the Lancaster Office of Mental Retardation, or LOMAR, as it was called. LOMAR was privatized several years.
1994.
1994. Dean, I think it'd be interesting to hear from you sort of what you've seen in the treatment progress from the time you started to now, and any thoughts you have about treatment in the future? What trends do you see?
Well, this is a very special community. We, in fact, are a magnet to people in this region for individuals with special needs. They come to Lincoln because they can find housing, they can find jobs. The specialists they need reside in this community, and the services for persons with mental illness and co-occurring substance abuse are very much alive and well here in Lincoln. The programs that we've been able to work with and manage and work with the phenomenal staff that we have at the Community Mental Health Center. That particular program is now 36 years old, has not appreciably changed much. I think it's always good to talk a little bit about the history. The Community Mental Health Center really grew out of a federal initiative where John F. Kennedy, one of the last acts that he performed was signing into law the Community Mental Health Center Act. And then that afforded communities to put up 20% of the total cost of operation, and the federal government would initiate an 80% match for several years. And that's how this community got into the business in the first place. Now that's how we funded it. The why did we open our doors, was at that time the Lincoln Regional Center was dramatically deinstitutionalizing thousands of people. And this community said, we've got to have a soft landing for people when they come from the institution to be a neighbor next door to me. They wanted to make sure that they had access to their medications, that there was an advocate, a case manager, a community support person to be their friend, their advocate, and to help them find safe, affordable housing, create a budget, make their appointments, be a good neighbor, find work. All of those things grew out of the kind of staff that we ultimately hired and the kind of job focus that the Community Mental Health Center had. Today we serve 5,000 adults. Some of those are still people that came to us when Lincoln Regional Center closed. So that mission continues as we speak. Another thing that happened about that same time in the late 60s, early 70s, dramatic changes in medications for persons with mental illness. And so with some of the new psychotropic meds and community-based programs, all of a sudden the large state institutions were really no longer required. And so that's the early history, and most of the programs remain in place. Now what do I see as far as trends? I think you'll see some real focus on co-occurring kinds of staff where we would hire specialists who not only know mental health but also know alcohol and drug treatment and counseling, because so many of our people come to us not only with presenting problems of mental illness, but they also are self-medicating. So they're using marijuana, or they're experimenting with pharmacy drugs, or they're drinking in excess, or not managing alcohol very well. All of this sometimes is done to make them feel better. I mean, if you're waking up every morning with your brain cells saying, this is another crappy day and I'm not sure I want to live through it, people do things to try to make those endorphins in your brain feel more positive. And so that's really the why of it. So we'll see more staff recruited and hired who come to the workplace with experience in both fields. I feel very strongly about that. The state and the institutions that prepare these people are turning out more and more dually licensed people. So they're not only licensed as a mental health professional, but they're also licensed as an alcohol and drug counselor. I think you'll see also what Ron will have, I'm sure, a lot more to say, but one-stop shop where you can walk in and receive primary care assistance as well as mental health care. Over the top of all of that, I think you have to overlay the fact that so many of our consumers are now stable and willing to begin to give back. So this whole concept of peer supports, peer operated programs, hooking a professional up with a peer to kind of co-venture counseling, nursing, all kinds of therapeutic settings is an exciting time for us in the future. So those are some of the new things that will change our original mission and our original charter.
I think you said better medications, probably quicker diagnosis, more awareness, has really helped a lot of people get the help they need maybe a little bit earlier than
And it's
in long
so
time ago.
much more humane today. I mean, when you really think about it, if you have a loved one, would you want that person parked in an institution with 2,000 other friends? I doubt it. I think it's much more humane, much more recovery focused and recovery oriented to be near your parents, go to the same church, go to the same doctor, shop in the same neighborhood stores, those types of things. I mean, that's really what we need to be about, is embracing and incorporating these people with very minimal needs. I mean, we're more like the persons with mental illness than we are unlike.
Sure.
So they should live next to us, and they should be part of the fabric of the community. So that's the fun part about this, I think, is finding a safe, affordable future for all citizens in our community.
This process allows us to look at the best way to provide those services, and I think that we're embarking on that process as we get the committee going and get into
I agree.
the new. Let's take a quick break, and we'll be back in a minute and talk with Ron Sorensen. Welcome back. We're talking again about the mental health transition process here in Lancaster County. I'd like to talk with Ron Sorensen now. Ron is coming in to take over the leadership at the Community Mental Health Center following Dean's retirement Friday at 5 o'clock. Ron, let's talk a little bit about the timeline, the process, and now moving into the future.
Sure, be glad to. We've broken the project of the transition, if you want to call it that, into 4 parts basically. The first part is organizing just the project, and that's essentially done. We got the team appointed. We started setting up appointments. We got the agreement between the Region 5 and Lancaster County as to whose responsibilities, things, various elements of this project are. So we've really started in the second phase, and second phase is defining what we want as the new service model. And that's going to involve first probably educating the panel as to what we mean by, in some cases, behavioral services, or what the Community Mental Health Center does. We will be looking at what consumer needs and expectations are in the community. We'll be looking at things out there which we may have not have thought of doing, but may have some successes in other places, new models, new best practices, whatever that may be. We'll be looking at funding, how we're going to fund these new services. Maybe there's some funding potential with services like Medicaid or Medicare, and with the Affordable Care Act, that will maybe change some of the things we can fund as well. So we'll be looking at all those things. In the end, what the panel will do is come up with recommendations. Where do we go from here? What services do we need? How should we fund them? How should we be organized? I mean, are there existing providers? Should we organize new providers? How should we do this to get this accomplished in the best way? And with those recommendations, they'll come back to the Lancaster County Board and to Region 5, and they will, of course, review them and look at them carefully and decide what fits best with what we want to do in the county, what fits best with state funding and regional funding, and make that decision. And then at that point, we move into phase 3, which is basically how we move from here to there, and that's what's been called by the consulting from the ITN process. Whether it'll be an ITN process or an RFP process is really unclear yet. But what we're doing is designing that process. How do we get everybody involved we need to have involved to look at possibly doing these services, developing timelines for that, laying out what they'll need, laying out service definitions, a whole bunch of work behind that. And then we'll set up dates and announce it, and there'll be a review committee which will have to go through and say, this is what we want to do, this is how we're going to go forward. And again, we get in the contract negotiation process if that's necessary, assuming there's more than one organization wants to do this. And we'll come back again to both the Lancaster County Board and Region 5 and find out how we're going to move funding around. How's funding going to go from Lancaster County to the region or vice versa? And we'll go from there. I think an important part of this process, while all this is going on, we're still going to have services being delivered. We're not stopping anything. The mental health center will be there. We'll have our doors open. Everybody will be there providing the services we need to provide. The final phase then really in the project then is the transition to whomever is going to do this. And whether it's one or more contractors or however that gets laid out, we'll have to move caseloads. We'll have to move, in many cases, staff if they are hired into these new organizations, or ideally we could move all staff to these new organizations. So that process will be just going through the process of who goes where the caseloads go, just details like what do we do with the shelves and shelves of case records that we have in the basement. And so a lot of things that just need to be laid out and accomplished, but that's basically the process.
You mentioned ITN. I think it might be important to explain what that is in.
Well, the HMA, which is a consultant company hired by Community Health Endowment a few months ago, came in with a recommendation as to how we ought to go forward with this. They basically looked at what they called an ITN. It's a negotiating process where you sit down with people and negotiate through who wants to do what, how much they want to pay for it, all those sorts of things. I don't know that works real well when you get into government, quite frankly. We require more structure because we do require that things are fair and have approached equally for all the parties. So that's why they typically do what's called an RFP process, request for proposals, where people will bid. And then they all come in with the same standards and requirements, and then people will bid as to how they're going to do it, and you select one of them. It's a little more formal, and exactly what that process will be, I don't know yet, but we're probably going to lean more to the formal side than the sort of relaxed, and we'll just work this out, a way of doing things.
Make sure that the services are available and how they'll be available.
Definitely.
And for our viewers, we will be doing more shows and having more information available as we go along in the process. The committee will have their first meeting soon, and as Ron indicated, there's a lot of education of some committee members, and good reminders for those who know about the mental health center operation. So there's a little education first, and kind of in the storm, norm, and perform kind of realm. You're storming at this point, but you'll soon be getting ready to move forward. And I think it'll be an exciting process, and we look forward to bringing information to those consumers and family members in the community as we have it available. I would like to take a few minutes now and kind of talk a little bit about some of Dean's accomplishments. And I didn't tell you this, Dean, and I don't want you to be embarrassed, but I think you've done some things that are kind of exciting at the Community Mental Health Center. We used to have what was known as the clubhouse on Adams Street, where some of our consumers could go spend the day, and that has morphed into kind of an employment readiness model now, and it is now called Midtown Center. I think that was a great accomplishment.
Midtown Center is now really a clinical rehabilitation setting where people used to drop in at Adams Street, but now they come to Midtown. We do an assessment, we find out what their deficits are, and then we actually begin to teach, and through a group, both individual and group processes, move to ameliorate their deficits, and then they actually do move on, and we see improvement that we can measure. Now that's totally different than the old model.
And it's a great improvement and
It
help.
is. It's a much more acceptable, best practice, evidence-based model.
Yes. Another one I think that is very noteworthy is the sex offender treatment program.
When I first came to the mental health center, I noticed that we had sex offenders coming to us for medication. Well, when you think about it, probably a sizable number of people who were registered offenders were depressed. They couldn't probably find housing very easily, couldn't find jobs. If they were contrite and felt badly about their offenses, all the more reason to be depressed. So we saw quite a few at the mental health center. Also scanned our staff, our clinical staff, and we had some of the same people in our location working part-time as we're staffing the sex offender unit at the Lincoln Regional Center. So for that reason, we decided to get serious about formalizing a place where sex offenders could be managed in the community, where we could do individual therapy, group therapy, train their families, frankly, to help manage them, and then even do some case management, alumni kind of drop-ins when they felt they needed a retread, if you will. This is done because of the inordinate number that we have discharged from corrections and the Lincoln Regional Center here in Lancaster County. A county this size should have maybe 400, 500 registered sex offenders. We're approaching 800.
Sure.
So there is a disproportionate number. In the last year, we've finally been able to get some state aid, and so now for people who are successful program completers from the Lincoln Regional Center Sex Offender Program, we're now getting some monies for those individuals. We still have people coming from corrections without any payment, and we have people who move to this jurisdiction because there is management assistance available. But it's the right thing to do, and I think the community is better served by having this population managed, and hope they never ever reoffend again.
Right. Another one of your programs is the art program, and I don't know how that's going to continue without you, but you might speak to that. Not just art, but writers.
Before I came to the mental health center, I worked at Centerpoint, and I was asked by Valdine Nelson, the director of that program at that time, to do some sort of exit survey study. And about a third of the responses came back that no one had ever asked about their passion, their art, their writing, their dance, their music. So we had all these right-brained people that were receiving services and felt that we had ignored that real passion of theirs. So we replicated the survey again at Centerpoint, and this time I got some exit interviews also at the Community Mental Health Center. Same number, about a third of the people said, nobody's talking to me about what I really care about most in my life. Very fortuitous, about 2 weeks after that last study, my wife and I happened to have brunch with Chip and Donna Wood. And I said, here's an idea that the Woods Charitable Fund might possibly be interested in. And so that's how it was started. And it's now 13 years later. We're now over 400 people in that program. Visual artists, photographers, filmmakers, maybe some 40 or 50 writers. We've just published our 8th anthology. So it's a very interesting thing. Now our docs tell us that if they're involved in that program, they don't go to the hospital as much.
That's interesting.
So it's like a job. For those viewers who are in the arts, they understand this immediately because it's so important. And so it's a way people can maintain their wellness through their arts.
It's an amazing program, and I've seen some of the art, and it's really good stuff.
And we sell their arts.
Yes.
We're approaching 200,000 in sales.
My goodness.
Over that 13-year period. Our collaborators are Parks and Recreation, and the Parks Foundation is the fiscal agent.
Okay.
So they receive all monies, pay sales tax, and then send a check to the artist. We keep 25% for the project. Centerpoint is and has been from the very beginning a collaborating partner, and the Community Mental Health Center is
Okay.
the other partner. So the three continue on. I've transferred all of the work that I've done through the years to a whole new crop of young artists and young staff people over at Centerpoint, and the project is going full tilt
Good.
forward.
Very good. Well, I can't begin to hit all the highlights of your time with Mental Health Center. I can say I have enjoyed immensely my years working with you, and I know the county board joins me in thanking you tremendously for delaying your retirement to stick around until we could get Ron on board, and we wish you all the best in your retirement. Hope you'll stay in touch. Prior to the show, you said you were kind of going to be out of touch, and so we'll give you a little time, and then we'll make sure that we have the contact with you again. It's been an honor and a privilege, Dean, and thank you very much.
Thank you, Gwen.
You're welcome. And I thank Jane for being with us, and Ron, and thank you for watching. We will be back down the road when we have more news to report. Thank you.